The Global Fund Initiative has fought passionately to eliminate 3 major diseases for over 14 years. As observed by a member of the delegation from the Federal Ministry of Health, Nigeria has benefited from the contributions over the years.
Global Fund came into place around 2002 when we are struggling to scale up HIV treatment. Then we barely had 25 sites providing ART in the program. With the support of PEPFAR and Global Fund, we were able to scale up rapidly, and today we have over 800,000 persons on treatment for antiretroviral in the country. So also on the TB program, it has helped to scale up rapidly TB diagnosis across the country. Also on the malaria eradication program, the availability of insecticide-treated bed nets was scaled up rapidly, and so many Nigerians have access to all these interventions.
With the latest global goal to eradicate AIDS, tuberculosis and malaria by the year 2030, the replenishment of the fund cannot be taken for granted. Montreal, Quebec, Canada played host to a mammoth crowd from different parts of the globe as they gathered for the 5th Fund Replenishment Conference. Canadian Prime Minister Justin Trudeau called on all parties to pledge with compassion, and indeed, many nations answered the passionate plea as $13 billion was mobilized for the 2017 to 2019 period to support major programs designed towards the attainment of the major goal.
The citizens of our global community can look proudly at what has been accomplished today. Thanks to an inspirational demonstration of unshakable will and collaboration, we will rid the world of AIDS, TB, and malaria.
The conference also offered concerned parties opportunities to analyze major challenges with accessibility, stigmatization, and human rights issues.
We need to have that conversation. We need to shift policy in terms of how discrimination in the healthcare system might happen.
These diseases are prevalent in Africa, in our rural communities most. So advocacy should go down to the rural areas.
We also need to bring men as well to the table. If we leave them and they are the ones that are making decisions within the household, we are not doing ourselves a great job. So it's important to dialogue with men, bring them to the table so that they understand where the woman's perspective is coming from as well. At the end of the day, there's full support from the men, and interventions are working within our African continent as well.
Because everyone says it matters, resource mobilization efforts are still in progress. For as some stakeholders say, given a model that works, partners may as well raise the needed funds to end the epidemics by the year 2030.
In Montreal, Quebec, Canada, Joy Oseago, NTA News.